Dr. Satya Ramdass from John Peter Smith Hospital, Fort Worth, Texas. I am an interventional radiologist. Today we are going to learn about radiofrequency ablation, or also called as RFA. This procedure is performed for treating tumors of the liver, either primary, that means primary cancer, or secondary cancer which has spread from outside the liver, either from small bowel, colon, stomach. It can be from lungs or kidneys. This procedure is performed using a fine needle electrode which is introduced into the tumor, and radio frequency current is applied, and that way the tumor is completely destroyed or eliminated once for all. This procedure can be performed in any patient, but generally it is performed on those patients those who are not a candidate for surgery. For example, patients have comorbidities like hypertension, diabetes, or other lung problems which makes them not a candidate for surgery. So those type of patients also we can treat them. The major benefits of this procedure are it is very safe because we are performing this procedure under local anesthesia and moderate sedation, and it is minimally invasive. That means we are making a very tiny nick in the skin. No incision is made, no stitches are applied, and there is generally no hospital stay. There are infrequent complications and very cost effective when compared to the surgery. And the overall success rate of this procedure is 85 to 90%, depending upon the size of the tumor and the location of the tumor within the liver. So now let us go and see how this procedure is being performed. As you can see, the liver, it has two lobes, the bigger right lobe and the smaller left lobe. You can see the vessels going into the liver. In the right lobe, we have a tumor which is growing. Today we are going to ablate that tumor with radiofrequency ablation. First, we give local anesthesia and moderate sedation to the patient, and we make a tiny skin nick to introduce a probe. And this procedure is performed under ultrasound or CT imaging guidance to precisely localize the tumor. Once we have done that, we introduce the probe into the tumor. The prongs of the probes are open. It opens up like an umbrella, covering the whole of the tumor. Then we apply the radiofrequency current. This current will generate heat up to 105 degrees centigrade, and that is when the tumor starts getting destroyed because of the heat. And this radiofrequency is applied for approximately 6 to 12 minutes depending on the size of the tumor. And once the tumor is completely ablated, we withdraw the probe after closing those prongs, and we ablate the track as we are coming down. And the whole procedure takes anywhere from half an hour to 1 hour. And that's how we try to ablate tumors of the liver by radiofrequency ablation. Let us recap what we have learned today. Radiofrequency ablation is minimally invasive, relatively cost effective, minimal discomfort to the patient, and safe when compared to surgery. Thank you. My name is Dr. Satya Ramdass. Today you have learned about radiofrequency ablation.